Psoriatic arthritis is a multifaceted disease. It involves a lot of domains. Skin is one of them, joints, and there are some other clinical manifestations as well, which are extra musculoskeletal, such as IBD, which is Crohn's and ulcerative colitis, and uveitis. So, the management of psoriatic arthritis is done in a multidisciplinary fashion. It is very important to have collaborations with the subspecialties such as your dermatologist, the gastroenterologist, and ophthalmologist. So this is a good opportunity to present about the disease. We will focus on joints because that's what I do, and we'll also talk about the overlap between the two diseases. No, I think there needs to be a lot more. I hear that it is very difficult to get in touch with subspecialties through consults and referrals. It takes long time. There's usually a long waiting list. So in our clinic, it's interesting because a dermatologist goes and sees the patients first and screens them for psoriatic arthritis. And I'm sitting right there to see these patients. So there's no waiting list for the patients. And and we also make decisions collaboratively. There is some discussions, some arguments for the betterment of our patients to decide which domain is the most prominent domain that is bothering the patient, and that's how we pick the treatment. Yeah, so today we'll start the talk with general epidemiology of psoriatic arthritis and pathogenesis and overlap between both psoriasis and psoriatic arthritis. But then we'll go into details about clinical exam. And I think that is very important for dermatologists to know because there can be joint pains due to many different reasons for our patients, including osteoarthritis, rheumatoid arthritis, fibromyalgia. So it is important to know the basics of joint exam and try and understand how to differentiate inflammatory arthritis, such as psoriatic arthritis, from these other entities. So we'll go over those details and then we'll talk about management and the collaborative management of both the diseases, psoriasis and psoriatic arthritis. Yes, so psoriatic arthritis is a type of inflammatory arthritis, and the other types of arthritis are like rheumatoid arthritis. So, rheumatoid arthritis is the most common type of inflammatory arthritis in which patients develop polyarticular, bilateral, symmetrical joint pain and swelling, as compared to psoriatic arthritis, where you can have inflammation, that you can have a polyarticular symmetric joint involvement, but we often see involvement of oligoarticular joints, that means less than 5 joints. Entheses are involved, causing enthesitis, and there's axial involvement also seen in a few patients, as well as dactylitis, which is swelling of the whole digit. And we don't see that in patients with rheumatoid arthritis that often. And there are other arthritis as well, which are non-inflammatory, like osteoarthritis. Osteoarthritis, you also see swelling from naked eye, but when you actually tend to examine the joints, you see this, the swelling is more bony. There's more bony hypertrophy rather than the cushiony swelling that you see with inflammatory arthritis. And then fibromyalgia is another disease which is not autoimmune, but patients develop diffuse body pain, including the joint pain.